why can education be seen as a social vaccine against COVID-19? Terje, the floor is yours.
Thank you very much for your nice introduction and for inviting me to answer such an interesting question. I have to admit, I'm a little bit prepared for this first question, so my answer will be a little bit long. As noted, my name is Terje A, Eikemo, and I am a professor of sociology and the leader of CHAIN, which is a center for the research on global health inequalities based here in Norway, where I am now. So I will do my best to provide a good answer to your question. Now, two of the most important resources a child is given when it is born. So two of the most important resources a child is given when it is born is health and the education of its parents. And as I will show you, these two essential resources are strongly related to each other. So in order to provide an answer to your question, we need to know how these two resources are related. Now, good health is important for children, not only because it will help them live through their first years, it's also important because it will help them fulfill their potentials in their lives. And this includes taking higher education or taking education at all. Now, it is also important for countries to have highly educated populations and thereby healthy populations in their efforts to obtain sustainable societies, which will also enable them to become more robust in the fight against COVID-19. So health and education are both important for people and for countries. And all people have the same rights to education and to health. But in fact, it matters where you live. Now, if you're born in a poor country, you're less likely to obtain your educational dreams, and you're more likely to live in poor health and to die earlier of preventable diseases than if you're born in a wealthy country. Our research has shown that every additional year of education matters for child survival, now everywhere, in rich countries as in poor countries. So looking at the bigger picture, education can therefore be seen as a social vaccine against fatal outcomes of preventable conditions. Now, we know that COVID-related deaths are also preventable. Of course, only the future can tell us the degree to which education and other forms of social status will protect against COVID-related illness and death. But I would argue that education in principle is a social vaccine against all preventable conditions. And it is a social vaccine for people, for social groups, and for countries. And I will illustrate this point a little bit further in the next slide. Now imagine that you are born in a poor neighborhood by parents without any education. The risk of dying before the age of 5 would be higher for you than for others born in more educated families and neighborhoods, regardless if you live in a poor country or in a rich country. Now, this is what inequality means. Inequality has no borders. It kills in all countries. So educational inequalities in health, they exist for all preventable conditions as noted, and all preventable causes of death that we're aware of. And they are therefore the biggest public health challenge that the world is facing today. Now, no country in the world has been able to protect their populations from the negative health consequences of educational poverty. These bars, they present child mortality in world regions from 1985 till 2000. They show that children born by mothers with high education live longer than those born by mothers with less education. So what does this mean? It means that education matters. It means that the roots of health inequalities are placed in the social environments where children are born, where they grow and live, and eventually where they work and age. So more education means better access to vaccination, to clean water, sanitation, nutrition, housing, healthcare, social networks, money, social security, and we can go on. And all of these are protective mechanisms against illness and preventable mortality. So unequal access to these resources by the level of education is key to explain the global health gap. And I would think and expect that this would also matter for COVID. Of course, the future will tell us this. Now, almost 20 years later, now you can see there are graphs that have appeared on the right-hand side. And these are estimates from 2001 till 2017. And as you can see, the bars are shorter, meaning that child mortality has been reduced, actually has been cut in half. But what can you see? What has not changed? Well, the pattern has not changed. Education still matters to explain health inequalities. So we need to address COVID by addressing social and educational inequalities. And the presence of such inequalities is among the biggest public health challenges that the world is facing today, because it leads to large variations in child mortality in the world. Now, this was the situation in 2017. The dark blue countries have the lowest child mortality from all causes, and the red countries and yellow countries have the highest mortality. And as you can see, there are large variations between the regions. Children do not live equally long in the world. And there's no acceptable reason why there should be differences, and why children should die at higher amounts than in other regions. And apparently the differences between the global north and the global south is quite visible. It shows what we are trying to do about this. Now, the fact that inequality kills at such large scale has made Shane take upon a global responsibility to monitor, to measure educational inequalities in the world. And we are explaining the causes of education on health in the world. And we are identifying policies and interventions that can reduce social and economic and educational inequalities in health and mortality. And we are not overlooking any region or country in this effort. So today, Chain is the first and only center of its kind. It's unique, we think. We think we are unique, of course, because we bring together universities, practitioners, international organizations, think tanks, the civil sector, the UN system, all together in the same organizational body with a common mission to reduce the global health gap. And in the next slide, you can see a little bit of the approach that we are taking. As you can see that the three pillars that we have, we want to explain, we want to monitor, we want to explain, and we are attempting to reduce health inequalities. We're looking at geographical regions, the life course, and we're looking at combinations of social disadvantage, which is what intersectionality refers to. So, but this is not enough. This is work we do with UNICEF, WHO, and the Global Burden of Disease Study, but measuring is not enough. We also need to explain, and we also need to change policies that can reduce inequalities. And this is why we are constantly reaching out to policymakers, European Commission, and governments. And this is why organizations such as EuroHealthNet, which is presenting later on in this webinar, and UNICEF are key partners of Chain. But even if our research and advocacy leads to change policies, that is also not enough. There are millions of people who are suffering every day, and they do not have time to wait for changed policies. They need help now, where they are now. And I would particularly mention the refugee crisis. And this task has suddenly become more urgent with COVID-19, as we know that the pandemic is hitting societies unequally, as Claire Bamberg will speak more about later. On the next slide, I'm also asked what chain really means. It refers to the problem and to the solution. So the problem is to be chained. It is about being born into disadvantage. So if you're born poor, it decreases your chances of living, of working and aging under poor social conditions. So these are chains that need to be broken. And we have developed tools for that, as we are explaining the causal chains, and because we have a chain of research, policy, and practice partners who are with us in this fight for social justice. And if we succeed in our efforts, this would be the result. And it would be the next step on the way to ensure that eventually all children in the world would live long enough to celebrate their 5th birthday. I would now like to thank you for your attention. Please do follow us on Twitter and Facebook and help us in our fight to reduce the unfair social inequalities in health and mortality that we see. And I look forward to the discussion afterwards and to answer questions that might have come already. Thank you so much.
Thank you very much, Terje, for your excellent and to the point introduction.